The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Angels Health Livestream, and your host, me, yours truly, Dr. Tom. We're going to continue the process a little bit, talking about low back pain today, but we're going to do it from a little different perspective, a diagnostic platform, if you will, and we're going to talk about thermographic imaging. And many of you already know what thermography is, and it's an extraordinarily powerful tool. Thermography measures heat and cold, so thermal changes within the body. And when you have a back problem, that back problem could be coming from many different platforms. So we're going to talk about what that really means. And I'm going to bring in an expert in the field, somebody who you've heard before on both the radio program, Dr. Tom Roselle Live on WMAL 105.9 FM in the Mid-Atlantic area, but also on Angels Health Livestream. And we're going to bring that in. I'm talking about Derreth Painter. We'll introduce her in about a second and bring her on board. But we're going to get into this very, very critically. You know, what are the actual cardinal signs, if you will, of low back pain physiologically? And those are the important things. You know, if we just say, oh, my back hurts, it can be there for 100 different reasons. As you've been following me, we talked about the emotional platform and so forth. But, you know, this is all leading into a class that we're going to be doing on Wednesday, the 14th of August at 6 p.m. at the Roselle Center for Healing in Fairfax, Virginia. Those of you in the Mid-Atlantic area, the Fairfax area, the Washington metropolitan area, join us. And I promise you, you're going to get some distinguishing characteristics. We're going to be talking about emotional back pain. We're going to talk about what really takes place from the environment of the intestinal tract and how those disc spaces swell, the nerves get inflamed. But also, we're going to add this piece of how diagnostic is a very important part to distinguishing what really is in front of you. And that's the field of thermographic imaging. And with that, I want to introduce Derreth. Hey, Derreth, thank you for taking the time and joining me today.
Thank you for having me. Appreciate it.
Listen, you know, I have a tremendous amount of admiration for the work that you do, and we've used thermography at the Roselle Center for years now, and you've been in the field, you know, I don't know, was it 15, 17 years, something in that neighborhood?
Well, it's about 17 years now, going on 18. I'm getting old.
Shh, don't say anything. Nobody knows. They're looking at you. You have no idea.
It's okay. Look, it's all good.
At the end of the day, thermographic imaging is important to the work that I do. And let me kind of set the stage, and I'm going to ask you a couple of questions so our listeners or watchers, if you will. I keep forgetting this is not the radio program. This is live streaming. People
eyes and ears. Yeah.
I know, right? So when somebody comes in with back pain, it could be radiation into the legs from the back. It could be something that just happened because of a sneeze or something that's been coming on for a period of time, or they get under stress and it takes place that way. And then, you know, things get calmed down and it goes away. But in my world, in the world of natural integrative therapeutics, if you will, diagnostic muscle testing, integrative therapies, applied kinesiology, we look at the why behind things. We look at the neurological platform, we look at the biochemical, biological platform, and we look at the decision-making process that the mind goes through relative to how the body expresses itself, because all of those things cause reactions within the system. They usually go hand in glove and they work tandemly. But a patient comes in and they say, well, you know, I've had this low back pain, and I ask them subjectively 0 to 10, and they say, oh, you know, chronically maybe about a 4 or a 5. And I said, does it spike? And they said, yes, and it goes up. And I said, what's that? And they'll tell me sometimes it's 7 or 8. And so we go through that criteria. Then we put them through a neurological examination, orthopedic examination, muscle function testing examination. We look at their dietary patterns. We put all of those things together to try to find out the why behind it. And unfortunately, we're often the last resort when somebody can't get an answer someplace else, because society's been programmed now to take this pill for that condition. So they've done that. They've had the injections. They've had all these things. And some of them modify the pain pattern slightly, but they never resolve it 100%. And because there's other underlying problems that haven't been addressed. So a patient comes in and we have palpable heat sensation in the low back, but they say that it radiates from the back into the groin. Now, low back pain can come from intestinal trouble to the back. There's channels that go from the gut to the low back. It can come from the kidneys and cause flank pain. That means pain on the outside lateral portion of the back. It can get so irritated and swollen in either one of those conditions and go down the legs. Or they can bend over and sneeze. They have this paid for abdominal belly that they have, they haven't taken care of in years. And sometimes it's just, too many calories. Sometimes it's just they haven't exercised. Sometimes it's a combination of both of them. And then we search in other areas. So having said all of those things, when I have a patient in front of me and something says, it's just not in the back. And I said, hey, Derreth, I need you to take images of first the low back and then give me your opinion and so forth. What do you see? What is your headspace? And how important is thermography in diagnosing? We're talking about low back pain, but we can extend it to other areas as well. But we'll start there first.
Well, let me start by saying first that you have a lot of diagnostic tools available to you. You obviously have x-rays of the spine and of the back, and you can take a look at structurally how things are going. In thermography, we're not looking at anatomical anything. We can't see bones. We really don't focus on structure. What we're looking at is blood flow. We're looking at pain patterns. We're looking at heat radiating because of insufficiencies or, things that are just not working properly metabolically. So we get to look at the other side of things. When you say, okay, let's do thermography, first and foremost, we're trying to limit the exposure to radiation because there's no radiation involved in thermography. We are looking at the body in that moment in time. Now, one of your doctors very poignantly coined the description of thermography as body Doppler. Very much like when you've got your weather storms coming in and you can see where the red and the white that's pinpointing where the worst part of the storm is. Thermography basically does the same thing, but we look also at how it's affecting other parts of the body or how other parts of the body are affecting that point. So we're kind of the missing piece of the puzzle. We kind of look at things from a standpoint of pain, radiation of that pain, how it's impacting the rest of the body. And in some cases, we can see the correlation between organ function. We can see the correlation in Eastern medicine application as well as Western medicine application as well.
It's important that we're able to distinguish tissue from neurological irritation. It's important that we know where other parts of the body may be contributing. So when you get a patient in front of you and we've asked you to do a thermograph, and you see this hot or cold area, cold would indicate that it's chronic, a lot of degeneration, but it's not inflamed at that moment in time.
Right.
But the patient is in pain. So at that point, you say, not for anything, but I took a picture of the front of the body. And you said you really need to look at the lower intestinal system.
Or the digestive tract, absolutely.
What do you see that would suggest that it may be coming from there?
There may be areas within the digestive tract that are inflamed, that are impacting on the back, the kidney area, the low back area. So we look at the whole body insofar as how the entire functioning of the body is taking place. Now, when I'm thinking about the example you just asked me about, I think back to a patient I had, God, it's been a lot of years ago. She was a very active, older 70, and she was doing a lot of activities, golfing, hiking, doing all this stuff. And you were treating her for actually low back pain and knee pain. I don't know if you remember this. And her knee kept swelling. And you kept working on her and stabilizing the structural part, right? And you said, something's just not right. And she goes, oh, and I think I have carpal tunnel. And and I'm like, Susie, what's going on? What's been going on in your life? Are you still, climbing mountains in Nepal? And what is that? Oh, well, I'm taking up golf again. Great, wonderful. I've got an instructor now. Great, wonderful. And so we didn't just do the low back and the knee. The knee was cold. It was not functioning, but she was having swelling and irritation. And then we looked at the back. Obviously, we saw some inflammation there. But when we asked more questions and tried to find out what her daily activity and everything was, we started noticing there was inflammation in other areas of the body. In her case, it was the hip. And I said, you've got to look at why the hip is so inflamed, that it's affecting the back and it's affecting the knee. And come to find out that her instructor had given her a different grip of the golf club, and they were working on that change in her swing, that it was affecting her wrists, which she thought it was carpal tunnel. And then when we looked at the hip pain and where it radiated to the low back and to the knee. Once you were able to visually see that, you were able then to work with her instructor and say, hey, we've got to shift things around. Worked with her a little bit and the instructor and continued to treat her. And then we did another thermography scan about, I want to say 2 to 3 weeks later, if I remember correctly.
Yeah.
And that inflammation really came down significantly. The knee started functioning properly. The swelling had been eradicated. She didn't have to go and get carpal tunnel surgery. So it was great just to see that visual and then look at the treatment efficacy as you were treating her to see whether or not that was improving her situation. That's what I love about thermography, is that we can help identify where the source is. We can track whether or not the doctor is doing something that is actually effective for the patient. And then we can see the end result. And we can do it throughout the whole process without any invasive application and no harm to the patient whatsoever. So it's great.
That's the beauty of it, because there is no radiation, there's no damage to the patient. You're looking in thermographic or thermal heat layers, if you will.
Yes.
And they go deeper and deeper. There interesting article that I came across as as I do all kinds of reading and so forth, that it was called the relationship between temperature and pain. And it was talking about higher temperatures and the relationships back and forth and so on and alike. It's the article was Adamo, and their conclusion was that simply that the results that they had studied, the conclusions, if you will, over the studies that they had done, confirmed that the pattern in the low back area, the region that shows up on thermographic imaging, is individualized. It's not standard across the board, but it finger points exactly to where the problem may be coming from. And so when you look at the arthritic low back problems, if you will, it'll show up if it's in an acute situation. If it's in the itis form, the arthritis. Itis means inflammatory response, and thermographic imaging is amazing at picking up that hot heat signal.
It can also pick it up in chronic form too.
Yes.
If that patient has had this chronic pain forever and a day, the body has become accustomed to it, but it's still in that inflamed state. So when they go to the doctor and they say, I've got this pain here, I've got this pain in the back, and the doctor says, I've checked everything, but I can't find anything. The nice thing with thermography is you can sit there and go, but you see this? That's exactly where I feel the pain. And so that visual really helps that patient to articulate and to demonstrate what's going on in their body. Where just, I mean, you said it a little bit earlier. When you're doing an examination and you palpate and you can feel the heat. How many people have hit their knee on their desk or something, and you feel that radiating pain, that, right? If you put your hands literally on either side of that knee, don't touch the knee, but just take it about a half an inch to an inch outside of that knee, you can actually feel that heat. So what we're doing in thermography is we're times 10 times X, right? We're looking at that with a camera that actually is going to expand that as far as the uh, what's the word I'm after? I just thought about it. This is what happens when you don't drink coffee for like a month and a half.
Oh, okay.
I know, yeah, right? But it's the specificity of the camera is such that we can look and see exactly what that patient is experiencing. And it's documented. So, that again adds to the patient's ability to regain function and to reduce pain and inflammation.
One of the things that's always been interesting to me when I send somebody for a thermograph to diagnose spinal pain or low back pain is that you would expect often just to see the area of interest, if you will, the low back or wherever they're complaining about it. That's where the pain pattern is. So all of a sudden I get this image and I look at it, but the entire spine is on fire.
Yeah, because it's affecting.
It tells me I've got either an autoimmune condition or I got a bug of some sort. I have a viral pattern that's invasive. And then we start investigating a little further and see what's there. That's a critical piece because you would get a sense through diagnostics that there might be something of that nature that's showing up. But when you see the images that way, it shows, yep, you're right. We got to go further. We've got to do some blood work. We've got to take some other imaging. And that really makes a huge, huge, huge difference.
Well, to your point, one of the things I will mention too is we have areas in the body that we can also check organ function, meaning immune function. There are areas, if we see certain patterning, it suggests that their immune system may be compromised. We can check the thymus, which looks at how your thyroid is functioning within the body. That suggests that you may want to look at, more into the metabolic aspect and how the body is actually, is it dealing with a virus? Is it dealing with a inability to have the thyroid function the way it is? And it's all, it's a cascade. It's a cascade effect with how the body is responding to either an outside trigger, or it's an internal trigger. Like you said, if you've got a diverticulitis, if you have a leaky gut, if you have, there's a lot. We could go down the whole list.
Derreth, there was an interesting article that I came across. It was a while ago, so I pulled it up this morning when I was prepping for the program. And it was from The Lancet. The Lancet is one of the most prestigious medical magazine journals, and it's been around for a long time. Often I'll disagree with what they publish. This goes back actually to 2009, and they were debating the imaging strategies for low back pain, and they were looking at a meta-analysis of multi-dimensions. They looked at radiography, straight regular films of the spine. They looked at MRI imaging, magnetic resonance imaging, and CAT scans, computerized axial tomography. That's what a CAT scan stands for, by the way.
Mm-hmm.
And what they said is that, in their opinion, because they don't look at the structural deviation like I do, I look for off-centering of the gliding points of the spine, the facets, which gives me an idea that the cord is either irritated, swollen, stretched, or the nerve is, and so forth. But from their point of view, and then they were going all the way down into the final conclusions and tremendous amount of references. And they said, heat signaling, which can't be measured really by these other components specifically, is more finger pointing, more indicative of where where the pain is coming from than any of the other ones. And this is supposedly a systematic review of all these different strategies and so forth in the medical arena. And that's really what we've seen and what we found over time.
I mean, all those diagnostic testing, I mean, I'm not opposed to them. I think they all have their place. Obviously, in our practice, we like to go for things that are going to be more effective, obviously, for the doctor to be able to assess, but also less harm to the patient or less stress on the body. So if we can initially start with the thermography and rule out certain things, and then if we need to take it up, up to the MRI or the CAT scan or those types of things, that's fine. But it's gathering all of those different pieces of information so that you can assess your patient properly and maximize their healing in the shortest amount of time. I mean, obviously, we want the patient out of pain.
You made a comment when you first started the program. You were talking about this person that had this pain, that pain, and then they ended up with a carpal tunnel and so forth. And the thing that so medically, let's say that the carpal tunnel is involved, right? And medically, they're going to go in and they're going to test muscles like this. They're going to do a Phalene's test, like they're going to put their hands up like this. If you get pain radiation, they're going to say you have a carpal tunnel. So their fix generally is they may do a small course of physical therapy, but then they're going to go in and they're going to slice what's called the retinacular band, the fascial band around the wrist, to free up the median nerve. That's a true carpal tunnel. It affects the thumb and it affects the index finger. Now, in my world, and I'll often just send them for a thermogram to rule out, the wrist is irritated, but it can be coming from the intestinal tract and the low back.
Yes.
Why? Because the intestinal tract is large intestine, small intestine, right? So large intestine 1, acupuncture channel starts on the index finger and it flows all the way up and it ends on the head and face, but it's influenced by the deep patterns of energetic platform. And then small intestines on the little finger. So it comes all the way down. So if those areas are irritated, the confluence, if you will, can cause that carpal tunnel, but at the same time will cause pain in the low back. So when you take a picture of the low back thermographically, and you take a picture of the intestinal tract thermographically, and you got finger pointing that says, uh-oh, we got both areas, that's cause and reason why that carpal tunnel, and it's only because the wrist now is swollen and irritated, causing that compression within the median nerve, if you will, which is the nerve that's affected in a true carpal tunnel pattern.
Right. And I mean, I'm going to deviate from low back pain for just a second. Yesterday, I had a patient who came in for a rescan. And when I did her initial, I had noticed that she had inflammation in back teeth or gums. Didn't know exactly what it was, but I said, you've got some significant inflammation right there. And she had gone to the dentist, said there was nothing wrong. And so she had sent the thermographic imaging and they said, come in, we need to really investigate this. She was having a lot of pain on that side of the body and a lot of metabolic problems to include digestive disorders. She was having lymphatic congestion, a lot of draining, but it wasn't moving. She felt horrible typically. And the dentist actually looked at the thermography and said, we've got a problem, and looked into it further. There was an infection, deep infection, where she had wisdom teeth removed. And they went in, cleaned it up, everything else. She says, oh my God, my brain fog is cleared up. My gut doesn't feel so, bad. So we're looking at root cause. And you know me, I take pictures of everything because I want to follow the trail and see where all this is coming from. And I look at it both from the Western medicine standpoint, but I also look at it from, as much as I understand, I'm not an acupuncturist, but also, as you said, looking at those points, because sometimes those acupuncture points will be inflamed or they'll be completely constricted where I can't see it at all because there's no blood flow, there's no energetics going on. And then you have to ask yourself the question, why is that? So that's when I give it to you guys and say, okay, here are the pieces, now interpret it. And we've done great with people, by looking at all those different components.
It's important that we put multifaceted diagnostics together. In our world of applied kinesiology, we respect the relationship between muscles and organ systems,
Mm-hmm.
spinal levels, and acupuncture pathways, and so forth. So the more pieces that you can put together and finger point. So that's, for example, let's say that there's a muscle that comes off the body at just about where the ribs meet the low back, where the last rib is, and
Mm-hmm.
goes into the hips. And that muscle is called the psoas muscle. And if that muscle is not working properly for a lot of different reasons, it can trigger low back pain, particularly positionally in different things, and for some patients, it's when they're sitting too long. Some patients, when they try to get up and they're locked and they can't get up the way they're supposed to. But that muscle can be missed in traditional orthopedic diagnostics or neurological diagnosis. And we can find it, but to confirm it, I'll often have you take a picture of the kidney area. Why the kidney? Because in our world, muscle, organ, kidney relates to the psoas muscle or the iliopsoas, the iliacus and the psoas muscle. And it's so important that we can show, prove exactly where it's coming from, and then enjoin the patient as a partner in their care. It's not about take this pill and call me in the morning or do these exercises, go away, let me know if it doesn't work. Or if that doesn't work, we're going to do surgery. You have to cooperate with all the pieces of the puzzle that you can put your hands on. You have to make it happen from a structural point of view. We do the work. We can reset the system. We can get the muscles to work. We can have the low back in a better position. But if a patient doesn't strengthen and work with isometrics initially and then move a little bit forward and increase range of motion and do those functional things. And by the way, we're going to show a lot of that on the 14th here at the Roselle Center for Healing. The professor, Dr. Harlan Browning, is going to be with me. And I'm going to try to enjoin you to show up so we can show the diagnostics a little back with thermographic imaging as
He's
well.
so smart, he makes my brain hurt. He has so much information, but it's good. I mean, what I was going to tell you is, I mean, you guys get to reset it, and then we get to take another picture to show the patient, look at all the work that you guys have done, and then actually show them the end result. The pain's gone, but they're still wondering, is it that confirmatory aspect of seeing a visual that inflammation and that constriction is no longer present? That's what's the icing on the cake.
Well, join us on the 14th of August. You're really going to enjoy this night. We're going to have some fun. I'm going to answer all your questions. Dr. Harlan, the professor, he's incredible. He's just a fountain of information that keeps on giving and keeps on giving. I enjoy this man. He's been with me, God, I think it's 23 years now.
23.
It's been a long time. And, we have this very dysfunctional family here that, we all kind of know each other's bad spots and we celebrate the good things as well. But please join us, 6 p.m. And how you do that is very simple. You go to drtomroselle.com and there'll be a spot there for you to register. You can also go to rosellecare.com and it'll be there. And you can register online. If you want to do it the old-fashioned way, real simple, 703-698-7117. So 703-698-7117. It's been one of those days. And register, but please remember that if you register, so we can prepare for you and we make sure that we have ample information and seating. If you can't make it, give us a call and just say, hey, something came up, I can't do it, and we'd be very appreciative so we can make room for other people. So looking forward to seeing you on the 14th of this month. And I promise you, this will be one of the best ones that we present all year round. It's a wealth of knowledge. We're going to be incorporating a lot of different things. It should be a great night. We're going to have some fun with it as well. We're going to show you what postural patterns look like when you're hurting, what things are actually going on. We're going to show you some corrective pieces as well. It'll be a fun evening. go to drtomroselle.com, go into the Ageless Health store and check things out. We got a lot of different things there sitting for you. We're going to be adding some things pretty quickly, and I think that you're going to really enjoy them. We're actually going to have other nutritional products and so forth that you can find and you can buy. So we're going to try to continue service, and let us know what it is that we can do for you. You can send me a note. I promise you I'll respond to it. But if there's something that you want to hear, a subject that you want to do, give us a heads up on it, and we'll see if we can put it together, put it on the program, and make that happen, as soon as we possibly can. So having said that, Derreth, thank you very much. I appreciate it. Sorry I got you out of your reverie today, but
No worries.
These people come first.
Of course they do.
I'll see you later on.
Thank you.
Listen, everybody, thank you so very much for your attention. I promise you that if you join us on the 14th, this is going to be one that you'll be able to take home. You'll have a better understanding. We're going to talk about the structural chemical emotional platform when it comes to low back pain. We're going to show you how to identify it. We're going to show you what it means. We're going to give you things that you can take home with, and we're going to give you some opportunity. Having said that, remember, I do this on an ongoing basis simply for one reason only. Not only do you deserve the information, but I truly love you all. Have a great day.